it's Monday, therefore logically it's time for...
Diseases I support in case I get them later on.
Today's ailment, if you will, is dizziness and vertigo. Professor Richard Geraghty is a neurologist at the Epworth Hospital. Good morning, Professor.
Good morning, Red. How are you?
Oh, dizziness and vertigo. We used to pay good money for that when we were younger.
Usually in beer, wasn't it?
There are many paths to enlightenment, Professor. Now, I think I would be correct in saying that the seat of dizziness would be the inner ear.
Yeah, it's often called the inner ear. Strictly, it's behind there, called the labyrinth, or a lot of people have heard of labyrinthitis. It's like a gyroscope in the bone behind the ear.
It's sort of three circles inclined, as you would expect, along axes sort of thing.
Oh, absolutely right.
Yeah, you know, and it's got fluid in it.
Yes, indeed.
Oh, and when you go on a...
You've been having lessons from that Scotsman.
Which Scotsman?
On ABC, Norman Swan.
Oh, Dr. Norman Swan, yes. No, it's just one of those things that as somebody who has an interest in ears, I am aware of the... and also, of course... having a sense that if you go on a merry-go-round or something that spins you out, I presume the fluid gets dispersed around the inner surface of that labyrinth in such a way as the message becomes confused as to which is up and down.
Oh, yeah, that's right. Giddy time when you're a kid, rotating. It's amazing what you could observe yourself of the physiology of the vestibular system just from mucking around as a kid and getting drunk later.
Is that how you developed an interest, Professor?
Not guilty.
And it is essentially a neurological ailment, I suppose.
Vertigo is, yes.
Meniere's disease.
Yeah, that's often people come and say, "Oh, my mother had Meniere's disease," but you don't really know for sure whether she did unless you had more details. So, trouble with vertigo is most doctors are not interested in it. It runs a very poor second after headache as the most deflating complaint from the doctor's point of view, but it's actually very interesting.
Well, a doctor if a patient presented with vertigo or dizziness, a doctor's attitude would be, well, just get over it or something, wouldn't it?
Oh, no, they often realise it's very serious, but it's difficult to pin down what the cause is, and the examination of patients is not that easy. So most people like to play to their strengths, so it's always discomforting when the patient's got a complaint which is not your long suit.
Right. Now I guess my interest is Meniere's disease.
Yeah.
There was a footballer famously, Brent Croswell, who suffered from that. And I can remember seeing him on the television thinking that would be really awful to be constantly displaced, as it were, not sure of where up and down was and feeling disoriented.
Yeah, look, I don't know his case in detail. Usually Meniere's comes in episodes, so you might be free of it entirely for some time, but there's sort of Damocles is always over you that you may plan this fantastic weekend, but instead you're lying on the floor with vertigo. But,
right, or you might be about to drive a giant truck in a mining region in the Pilbara, and you're suddenly struck by it.
Yeah, that would be bad.
Oh, how does Meniere's disease work exactly?
Well, you picked the one where we don't fully understand what the actual cause of it is, but basically patients can get very severe vertigo, and often, unlike some of the other causes, it's often sort of ushered in by some warning. There may be some fullness in the ear the evening before, the hearing can be depressed during the attack, and they get ringing in the ear or a sort of thudding sound. But neurologists don't see as much of Meniere's disease as ENT surgeons do, so I might not see a case for a year.
How is surgery sometimes indicated in the matter of...
Not for that, but famously Alan Carpenter, who was one of the early astronauts, had a different vertigo condition, positional vertigo, and in order to go back into space, he had an operation to plug one of those semicircular canals you mentioned earlier, and to fix his vertigo so he could get back into business.
That's an interesting concept. A spaceman who gets vertigo. I mean, I guess vertigo has, it is a symptom of, just as pain is an indicator that something is not quite right, so vertigo also can be an indicator of the fact that you're upside down, for instance.
Yeah, that's exactly right. It's important. Vertigo is a symptom. It's not the diagnosis. So, and some people will have vertigo from pathology X, and then another guy will come with the same pathology, but he just won't have vertigo, but he's still got the same disease. So it's a symptom, and you have to interpret it.
I can't. On your fact sheet that I have in front of me, I can't help noticing that tinnitus, ringing in the ears, and deafness are additional symptoms of malaise of the labyrinth. And I'm thinking, well, I've got a bit of that, but I think I've got it. I earned it.
Yeah. Yeah. Well, the nerve, the vestibular nerve, which looks after the balance and vertigo issues, is plastered right next to the hearing nerve. So occasionally someone will get acute vertigo and go acutely deaf in the ear, and that's unwelcome to say the least.
Well, happily, I've just got tinnitus, but not vertigo.
That's excellent.
But should I get vertigo, I will certainly be seeking your counsel. Thank you for talking to us.
Pleasure. Thank you.
Professor Richard Geraghty, neurologist at the Epworth Hospital, in regard to